Peace and blessings, and welcome back to this episode of the Mic Council, where we talk about the issues that affect the hip-hop culture and hip-hop generation outside of music, because if hip-hop truly is a culture, it affects all people based on religion, philosophies, education, economics, and more. And today I have a doctor on who's going to talk to us about the vaccination and about the COVID pandemic. Please introduce yourself to the people.
Hi, everybody. My name is Theresa. I'm Dr. Theresa Adeliyi. Thank you for having me.
Oh, it's a pleasure. Everybody who does not know, Dr. Theresa is one of the guests on the Recap with the Goodfellas. That's one of our partner networks that we talk about everyday events and things going on in society. And we wanted to bring that to the heritage hip hop crowd because our tagline is that hip hop is not music, it's God. And if you know God gives you not only your soul, but he gives you life. And how you celebrate it and represent it is, how you show reverence. So it would behoove us that if we are God's heritage and our heritage is hip hop, we got to bring the truth to the people. So can you please give people your background, how long you've done medicine, what kind of doctor are you, and what made you go into the field?
Hi, everybody. I am an Ob Gyn practitioner. I have been practicing independently for the past 5 years. And I say independently because as the process of becoming a doctor, you go to medical school and then you also have to do your residency. For me, it was a residency in obstetrician gynecology. And that's a 4-year residency. So after that, then you're allowed to practice on your own. And for me, it's been 5 years, but altogether, it's been about 12 and a half years of medicine. Why did I want to go into OBGYN? Well, I guess initially wanting to be a doctor was really observing my grandmother, who I lived with at the time, battling diabetes. I lived in Nigeria for a formative part of my years, about 10 years. And I saw how the healthcare system in Nigeria was not very adequate in treating these kind of ailments. And so she spent a lot of time in the hospital, and I think that was my initial exposure to medicine, and I just wanted to be part of that. In terms of OB, I feel like OBGYN kind of called me versus me choosing it, because I think it was a combination of all the things that I really felt like my personality was about, which is taking care of women, taking care of, African-American women, minority women, but also really having a passion for public health, because I think that a lot of our issues that is prevalent in the minority community, a lot of it has to do with public health infrastructure, at least lack thereof. And so I felt like OBGYN was the field for me in terms of reaching women, because again, I also feel like women are the cornerstone of families. I'm sure people have different views of that, but I feel like women hold up families, and women are the people that bring for the most part, their family members into medicine. And so I feel like taking care of women, you're taking care of families as well, because it's the woman that's going to bring her husband to the doctor. For the most part, it's the woman's going to bring the kids to the doctor. So I felt like just caring for women and having healthy women is a way of also taking care of communities. Technically, I just felt like OBGYN had a different variety of things for me to do in terms of like office and surgery and just really, again, public health policies that I can just bring together. So that's where I guess my passion came into healthcare.
Health is one of the most, I say, godly things a person can do. I mean, as a kid, I remember telling my mom when I was like real little, like, "Mommy, I'm gonna be a doctor and buy you a house." That's the main thing I always thought, because my mom was a nurse. She's like one of the like top celebrated nurses in the state of New Jersey at one time. For her work.
I think a good nurse is like a really, really good nurse is a really important cornerstone of medicine. Definitely. Yeah.
Most definitely, because nurses I mean, not to say doctors don't, but I know what I've learned about nurses from how my mom worked. Nurses are the front line that introduces the doctor to the patient. So they have to have like a certain repertoire or relationship with the patient to introduce the doctor to that person, so that you can have, as a doctor, a more defined talk. But with them, it was more getting their nerves and their emotions ready to meet with the doctor, so they're ready for treatment or ready to be served by the doctor,
I 100% agree. To the opposite side, which I'm sure we're going to get to, is the nurse can give the doctor a certain picture of a patient right or not, biased or not. And I think that, yes, nurses, and I completely agree, it's not to take away from doctors, but I think that nurses really know the patient. They're the front line, like you said. The manner in which they're trained is really to take care of the patient. We look at disease process. We look at how do we treat the disease process. Nurses really take care of the patient, emotional, psychological, and the family. They're the gateway to the family as well. So I completely agree with that.
2020, thank God that is over, was
Woo.
the year. It was the year that I think death became mostly apparent to a lot of people of all different ages.
Yes.
So in the hip hop community, it's a line by the Jizza when he says that when somebody dies in hip hop, the nation stops because of how young it's perceived that hip hop is, And the shock for me is people in my age bracket and older are now passing away. So you're like, Dag, I used to look up to this person and they're leaving. And unfortunately, we just lost Shabadoo from Breaking, and famous locker, and he died of COVID. It was speculated that MF Doom died of COVID. We have so many people in the hip hop community who unfortunately get killed due to street things, but diseases and health have been primary focuses of the community. I want to ask you this, from your expertise in meeting with women primarily, but I know you've seen other things.
Yeah.
What is the effect that you think death has had on our people and people from the, let's just say 35 or under? What effect has that had on people of the culture and generation with the more apparentness of death in 2020?
That's a good question. I look at it from two facets. I think that because of our history of, just the history of the black history in America, we're just so used to loss that this pandemic, it just uncovers the disproportionate nature of how death affects us, which I think has made us a little bit more immune to, like, disconnected from that. Because when I look at, patients that I take care of, women, a lot of them come in and they just really don't take this seriously. There's some people that take it seriously. There are other ones that do not take it seriously, but I feel like there's more proportion of women and therefore their family members that do not take COVID seriously. I think part of that is because we're just so used to loss in so many different facets of our life: gun violence, healthcare, people dying from healthcare because they didn't get the right care, or whatever the case is. And so I think my experience has been indifference in a lot of ways to the loss. Like, it's kind of like saying like 300,000 people died. It's just like a number. It doesn't really touch us. And I feel like at least the way they act is just not really, it doesn't penetrate them, their heart, that says 300,000 people is a lot of people. I think because when you compare that to, I guess, the immediate of trying to, get by, trying to have jobs, you don't have to, you're trying to pay your rent. It's relative. And I think in our culture, we're very good, maybe it's been forced upon us to compartmentalize loss and to compartmentalize these kind of things so that we don't really have to deal with loss, but also we still have to survive, And so I think there are some people that have been affected by this, and you can tell that they're affected by it and they're making changes. But for me, in terms of healthcare, I really feel like there hasn't been enough people that care, that really show that it's affecting them in a way that makes them want to change how they are. I hope that makes sense.
Oh, it makes perfect sense because you're going into PTSD. A lot
Yeah.
of us get post-traumatic stress,
Absolutely,
post-traumatic slavery disorder, and the most lucrative economical disorder we have in the country is racism. So if you look at the history of the medical profession in this country, when it comes to people of color, especially quote unquote Black people, it's been very one-sided, which is I'll just call it evil. When we look at, just for example, you have famous doctors who are in your profession, OBGYNs, who traumatize women by cutting them open and letting them bleed.
Sims, one of them. Yep.
We had one of my favorite racists in the world, who was Dr. Sigmund Freud,
Mm-hmm.
who was doing things in people's heads and wrapping paper towels around people's brains, calling it sexual disorders. You know,
Mm-hmm.
we have the doctor who just died, Dr. Susan Moore, rest in peace, who was saying she
Yeah.
was treated unfairly in the hospitals. We were
Right.
told that there were people who were putting folks on ventilators and giving them not the right medicine and things so they could get out the emergency rooms and things so they did not have to deal with them. There's also, through slavery and racism, it said that people of color weren't human, so the certain pains that Caucasian people felt we did not feel, didn't register with.
Right.
So we were able
Right.
to take the abuse and it was okay.
Mm-hmm.
Knowing that the medical system or medical health has this type of aura and stigma on it, how do we repair that so people can understand that it's important to go to the doctor and get checked out and not just think ginger ale can heal them and just taking the aspirin is okay?
I think the work has to come on both sides, but I think the more of the work has to be done by the medical professional. And because we have been and I include myself in this, even though I agree with you, all this history, I battle that every day with my patients, you know, trying to be, it almost seems like I'm like an insider trying to promote what the white people are doing versus like trying to be for my Black people, you know? So I'm always walking that edge. But I do believe that in the medicine field, we do have to do a better job of letting and being what's what I'm looking for, open and being like, you have to go out of our way to basically want to show our Black and brown people that we understand the history, we understand why they're not trusting of us, so we have to go out of our way to explain things. And I think that's the way that I practice, which is, not only am I going to tell you this is the options that you have, I can tell you the reason why you should or should not take this, but the reason what would happen if you don't do this, and still leave it up to my patients to make a decision. They have to really trust our patients to know that they can be informed. But I think what my colleagues are not doing a good job of is, we're just, as doctors, we're just so used to saying, you have this is the medication for it, go take it. We're not really aware of the fact that not only do they not trust us, they take the prescription, they might not even go fill it, not because they don't want to, but because the dismissive way that we have given you this prescription makes me feel like you didn't really hear me, right? So we're trying to, I would say, in medicine, in terms of medical school, we have this thing called cultural competence. We're trying to educate, you know, upcoming medical students just to understand what cultural competency means. We're talking about implicit bias as training, as part of the residency training. So we're doing some things that, you know, is probably not apparent to people outside of medicine, but we have to do better. In terms of our people, you know, it's a catch-22. You still have to go to a doctor to see your doctor for your medicine, for your diabetes, for your hypertension. You still have to do it. I think that seeking out doctors that are like you is the first step, because even if you don't trust medicine, well, people in medicine, you are more likely to at least trust someone that looks like you. And so I think that instead of just saying, I'm not going to go to the doctor because they're going to tell me I don't have something or whatever the case is, just seek out a Black professional. I know a lot of my colleagues, even myself, I seek out Black dentists, I seek out Black everything, because even as a doctor, I experience, you know, biases in healthcare. And so when I go into like emergency department or whatever the case is, I don't let people know that I'm a doctor, because I want to see how they evaluate me by just being Black, versus like, when you come in and say I'm a doctor, then sometimes you don't really know if they're treating you the way that they're treating you because you're a doctor, versus like, she's just a Black person here seeking help. And so I would say it's a two-way street, but the work has to be done for the most part by the healthcare system. We have a long way to go, and I'm hoping that I can be instrumental in making that change. But yeah, we also have to be open as a community as well, despite the history, despite our experiences with it. So
One thing that works against you that's from the community though is
mm-hmm.
the teaching of being a foreigner, being a domestic, and they call it Yankees and stuff like that. You know what I'm saying?
Yeah.
Because in the inner city community, education is a choice. Well, most people who come from other places that come to
Yeah.
America, education is like the foundation
Yes.
of what
It's
is
expected.
necessary. So that's always been an issue I've had with the medical profession, and education of the medical profession as well. Because when we would go to the doctor, it was very rare you saw a Black doctor in the 80s. You see what I'm saying?
Yep.
I'm showing my age right now. And when you had one, you held on to that doctor, and your entire family went to that doctor until
Right.
like maybe you had a choice, but you always had that line of, I treated your mom, I got you, your grandma, we were all stuck together. And now with the influx of people coming into the country, which I'm not against, you have people who don't trust the medical profession because of the cultural differences. How does the cultural differences, in your opinion, separate people from trusting doctors besides the racism?
How does the cultural differences separate people? I think you're right. Culturally, because I'm African, I'm from Nigeria. I think that because, like you said, education is just an expectation. It's, you know, you grow up, you're either going to be a doctor, a lawyer, accountant. That's pretty much it. Maybe a teacher, you know. That creates a separation from the Black American. I understand that, because I think for at least my generation above me, they look down as, because like you said, education is not a priority. Not because we don't want to, it's because in terms of Black America, it's because of the, you know, all the roadblocks that's in, you know, in obtaining this education, you know. Like if you're from the inner city, you know, going to college may not be like a priority because you never see, like, you don't think that is a possibility because you have to deal with death around you. I get that. So I think that, yes, there is this expectation, but again, it's an expectation that's not really it's not really there. It's almost as if it's like a history of it, but not necessarily a persistent thing now. It's the same with the culture of, like, you know, when your family members have experience, like you said, with, like, you know, racism with the white people, it kind of is pervasive in the family. It's the same expectation that they have with, like, oh, this doctor is African, so, you know, you might expect the same thing. It's not. I don't believe that it's as prevalent as people think it is now, because I think for the most part, a lot of the, you know, African non-Black Americans that are in medicine, a lot of us grew up here, you know. So I think a lot of the expectation of this looking down on, you know, Black Americans, all these history that we have, is not as pervasive as I think, as my experiences show me. Is it still there? Yeah, because there's still older people that are still practicing medicine, but the truth is they are being phased out. They really are being phased out. So what can I say about that? Is just, again, we kind of have to take history with a grain of salt, but also with the openness that you still have to engage with someone in medicine. And who better to do it? Is there going to be the the African doctor versus like the white doctor? I would say still go with the African doctor, because the African doctor, at least for the most part, will still understand your plight more than a white doctor. So it's a little bit bending of both sides, I think, has to happen. So
I
yeah.
agree totally. Because I was just talking to one of my best friends, shout out to Nasif. We were talking the other night, and we really went through our history of education in this country. And I said, high school, I didn't learn a goddamn thing. I really did. And you know what the sad part about high school was in our conversation? In high school, you're given a guidance counselor, correct?
Yes.
Did you meet with your guidance counselor?
Not once.
Me neither.
Yeah.
And we never heard anything about college or anything. It was something that had to come independently. And my family did not teach us about college independently. I had a sister that went to college, and me, I was just the expectation, but I did not know. So once again, to not like disparage the American community who's going to watch this, we just have to understand education has always been the answer, but due to the unfairness of the education system, plus the other systems that run this country,
yeah,
which will go into our COVID conversation, we are behind the 8 ball from the womb to the grave, and it's ridiculous. You know what I'm saying?
100%. I have to even add to that, even though like the expectation of like college was always something that was ingrained in me, without like, it wasn't like, you know, are you going to go to college? Is which college you're going to. Because in America, I was one of the, like in my family, I was the first person going to college with the intention of doing something higher, you know, postgraduate. I didn't learn a thing. I went to an all science high school in Jersey, but I didn't even understand how to study. I was not prepared for college. When I got to college, I'm seeing all my classmates, they've already taken not SAT, but ACTs. They've done that. They know how to study. They know how to get register for classes and how to pick their classes. I was literally starting from the bottom, and I didn't have anybody at home to teach me how to do all these things in college. So I was essentially just trying to figure it out my first year in college. And my grade point average my freshman year was like 2.5 because I didn't know what I was doing. You know, I worked my way up because I had to figure it out myself. So not only from a person that was already expected to go to college, even my family didn't know how to help me navigate that. So I can totally see how this will be a thing for, you know, Black Americans when education, or at least the progress to trying to get to education it already has its, you know, roadblocks. So definitely.
So with that being said, that takes us right into the COVID conversation. Shout out to
Yeah.
the person who made COVID what it is, because they're the devil. And
There are.
if you're buying Xboxes, you're supporting this crap because Bill Gates is one of the devils behind it. Allegedly, in my opinion.
Allegedly.
Allegedly. I don't know. He's been talking about it for 4 years, and then it happens. There's a plan there, in my estimation. But like I said, that's just my opinion. I don't know for sure. But COVID has become the hot topic for the year besides Donald Trump. COVID has affected just as many lives as Donald Trump. The only thing COVID has done is put its name on it, while Donald Trump still hides behind Russia elections and whatever else. I don't know. He's a comedian, right? Can you explain to us what exactly is COVID? And for all the smart people out there, allegedly, for all the smart people out there who saw COVID on the Lysol can you tell us what the difference is between this COVID and what they think they understand by seeing it in print on the Lysol can?
Well, COVID is a coronavirus, right? So there are multiple types of coronavirus subtypes. I would say, and the coronavirus is very common. There's different kinds of subtypes of it. However, COVID-19, and the number 19 is because it was found in 2019. This particular COVID virus, coronavirus, has a strain that it not only the way that it jumps from one person to another person is very rapid. Typically, viruses like coronaviruses, you kind of have to like cough and hack yourself in the same vicinity of people for that to kind of catch on, aerosolized. But this one, you don't have to do much. You just have to talk and, you know, have some aerosols coming, and it basically attaches itself to your nostrils and your throat. So the vector in which it kind of transmits is very sophisticated than the typical, you know, cold viruses and like that. And so that's the difference between why this is so bad versus, you know, the other types of coronaviruses or even the flu virus. And what it does, what we found out is actually affects blood vessels, which is why it has different ways of manifestation when people get it. You know, your body is full of blood vessels from your heart to your toes, you know what I mean? So if it affects the blood vessels the reason why some people don't have smells is because your small blood vessels in your brain can get attacked, and then you lose your sense of smell. Some people have neurological symptoms because most of the viruses are affecting, I know you did, it's affecting the brain because that's the endpoint of that virus. Sometimes it's your heart, sometimes it's your lungs, which is why this virus is very hard to predict how it's going to affect each person. But the reason why the people that are high risk are the people that have, you know, cardiovascular disease, which is hypertension, diabetes. These are all diseases that already affect your blood vessels to begin with. And so that's why the virus can just latch on an already diseased blood vessels and just cause rampant disease. So, yeah.
That's tough. Because
it is.
From my understanding of coronavirus, it came from me having it. Now, for my experience with coronavirus, I did not lose my sense of smell. I did not lose my sense of taste. I was losing my memory. I was getting chills. I had shakes. So that's the nervous part of it where I couldn't keep my hands straight.
Yeah.
And I already had problems with sleeping, but my sleeping patterns were very, you know, disorganized now, to the point, and mentally I received the gift of brain fog every now and then. That's why I pause more when I talk, because my words, it takes time for them to come out. You see what I'm saying? So
yeah,
my experience with this wasn't even a cough. And when I got or received my symptoms, it was 3 days into the diagnosis. So who knows how long I had it.
Right.
You know? But at one point, this virus hit the country and it was labeled the China virus by the comedian in office.
Yep.
And then it turned into the nigger virus, as quoted by the Proud Boys and a lot of the militias. Why do you think it hit the people of brown and black descent community so hard?
I think that it hit us harder because of maybe 2 or 3 reasons. Number one, because of the healthcare disparities and access to healthcare, like we've been talking about, we're more likely to suffer from, diabetes that's uncontrolled, hypertension that's uncontrolled, all these things that makes high risk patients when you get COVID. We're more likely to have that because we're just not easily accessible to healthcare. So that's number one. Number two, a lot of us live in generation households. There's like grandma, family members in the household. Either maybe grandma's taking care of the kids or for whatever the reason is, right? And then thirdly, a lot of us are working the frontline jobs. When you go to especially in the hospital, a lot of the environmental workers are African American, black and brown. Bus drivers or grocery places. Those are all first line access for people to really get this virus. So it was a cumulative, all of these things that makes it more likely that this virus was more rampant in our community, for sure. And then when you get the actual virus, again, when you have to deal with healthcare, we don't trust healthcare, we don't go to the hospital as soon as we get the virus, and or when we do go, we don't get believed that we have it because for, again, all the reasons we've already talked about. So I think for all those 3 facets, I think definitely hit us more. And I would say one more thing that I remember in the beginning, everyone was talking about, oh, it doesn't affect Black people. And so everyone thought like, oh, we're safe. No, we don't need to wear masks. I remember specifically saying that it don't affect Black people. I'm like, we're just not reporting it just yet. It does affect Black people. So I think for a little bit of time, we really thought that it wasn't really affecting us. So I think that would be a small proportion of that, but yeah.
The sad thing is that as people of color started to wake up to the coronavirus, Caucasians
It was too late.
going to sleep, and it reversed.
Yeah.
And we've seen that in America from the last thing I've seen from my sources. Shout out to Al Jazeera, the Young Turks, MSNBC. I watch a lot of news, so
Me
I like to stay informed. I don't like to go by word of mouth,
I agree.
And shout out to Dev of AEP, because he made a point that we have to learn how to research and not go off of third-party resources.
Yeah.
Opinionated,
I read on Facebook, look, no,
Right.
Facebook is not it.
Right.
Like you have to do your own research, click on things and go outside of Facebook.
Exactly. So
Yeah.
me doing my research, I've seen in this country, the Caucasian population are more affected by COVID now, and it became even more prevalent due to the non-mask wearers and a lot of the Trump supporters, who, as you have seen in lots of critically acclaimed viral videos of people getting in fights, not wearing masks. It was up to over 30% in South Dakota, Montana, and areas like that, because people refused to believe that they had coronavirus because, once again, it was the nigger virus.
Yes.
How dangerous is it for people not to take notice of it, even in the decline of 2021 with the rise of the vaccine talk, to which we will get to? How dangerous is it for people to still not consider this thing real and walk around and be amongst people like everything's okay?
It's very dangerous. I feel like unless it really affects you, for some reason, you have to be hit over the head with this thing for you to really believe it. It's dangerous on 2 different points. We don't have enough doctors or nurses to take care of people. So you may not even get coronavirus, but you might have a heart attack and still not be able to be admitted to the hospital because of your heart attack. Like, it's not just, oh, you're not getting coronavirus, or it's not about you. It's more like, you can get coronavirus, don't have any symptoms, but like when you're shedding the virus, you're giving it to your daughter, you're giving it to your grandparents, you're giving it to like your sick, uncle. So I think it's dangerous to say, oh, I don't have to protect myself because I don't care if I get coronavirus. Yeah, you can get coronavirus, don't get sick, but someone else that you love gets sick. That is the problem. Or the argument is, well, it's my body, my choice, some shit like that I hear. Like, it doesn't make any sense, like your body, your choice. Like, at some point you have to think about someone else other than who you are. just you. And I think that's one of the things that coronavirus has kind of showed us this past year, which is, we're very individualistic. And so we don't really care about what happens to other people. We just care about us. To bring that home, like I said, we're running out of people to take care of human beings. So it's not about getting coronavirus anymore. It really is about, your loved ones that might need a doctor that don't have enough doctors, or a loved one that might need surgery that can't get the surgery because, the hospital is full. We're not doing any surgery. There's so many different ways that coronavirus can affect you other than actually getting the infection itself. And for people to think that, oh, this is not such a big deal, I think what we haven't done a good job of, not us, but like media, is to show what coronavirus does other than kill you. Like you said, you have brain fog all the time. We're only talking about the death. Yes, almost 350,000 deaths. It's awful. It's really awful. But there's like 3 times that amount of people that have scarred lungs. There's 3 times the amount of people that don't have, they don't have memories or good memories anymore. They have all these other side effects of COVID that it's going to be a pre-existing condition from now on. So now we talk about insurance. You can't get insurance if these Congress have their way of striking down ACA. There's so many subsequent issues that comes out of COVID that people are not really talking about, and it's really, really bad. There's no other way for me to emphasize how bad this is. It just is in so many different facets.
One reason why people do, I can tell you for my understanding of it, and this is not alleged, this is real. One reason why I know a lot of people don't believe it is because early when people were dying in the numbers, everything was considered coronavirus.
Right.
And it threw a lot of people's understanding of it off. So I want to ask you a question. If a person dies of a heart attack, can it be COVID related?
It could be COVID related, because if you didn't have COVID that made your heart a lot weaker, we may not have died from the heart attack.
If you had we already talked about respiratory. So let's go to a side note before I go back into this. When I ask people what is hip hop, I always tell them hip hop is like your body in relation to what you call music. And one thing that harmony, I always say this is harmony. Harmony is when things work together for the good of one purpose. So your body is an instrument of harmony. So if anything throws that harmony off, it's called a disease. You know what I'm saying? So if COVID can be the virus or the disease that causes your body to not function at a high purpose, being that it can affect your brain, your heart, your lungs, vital tissues and vital organs, is the early death numbers reliable when they said this person died of this, but it was COVID related? Did COVID actually cause that death to be counted on that world counter?
Yes. And the fact is we actually undercounted how many people actually died of COVID complications. It's like saying that, someone that had a well-controlled diabetes, for example, well-controlled, you've been doing just fine, and then you get COVID, you've been in ICU for 3 weeks because they can't really ventilate your lungs. The reason why you're more susceptible to having to need ventilation is not because of your diabetes. It's because COVID made it worse. You would have been okay if you didn't, like, your diabetes was controlled, you didn't have COVID, you wouldn't be in the hospital. But because you had COVID, despite your diabetes being controlled, your body is susceptible to this disease because that's just the nature of the disease. Like you said, it's no longer homeostasis happening. It's just, you can break your leg, but if you can't heal because you also got COVID, now they have to, amputate your leg. It's not because you broke your leg that you died from it. It's because you got COVID that made healing harder, So absolutely, there's a lot of comorbidities of, that you may not die from, but that you wouldn't have died from if you didn't have COVID, is basically what I'm saying, So yes, you can have a normal disease, not a normal disease, but a controlled disease, and die because COVID made that controlled disease uncontrolled. So
in our communities right now, we have a lot of people who do not trust medicine, and they go to naturogenic and they do homeopathic or whatever it's called, right?
Yeah.
So how does the medical profession, from your standpoint, understand? I mean, I don't expect you know every answer, but your mind is very valuable to this, and I want to know what you think. how do they look at our naturogenic medicine and how people would rather go that route and try to help themselves with black seed oil and vitamin D, zinc, and stuff like that, instead of taking the shots and the things that these medical professionals give them?
From my perspective, I think that could be done for certain things. For example, hypertension. Yes, there's medication for it, but I have seen people change their lifestyle. They started doing some supplements, like you said, homeopathic things, and they were able to control their blood pressure. I think that's great. I don't think that trying to do homeopathic things to try to control certain disease process is a bad thing. What I have a problem with is when people are trying to do the same thing for cancer. Like, really? Yes, I have seen that. Or, you have blood clots and you think that homeopathic things or herbs and things is going to help get rid of your blood clots. It will not. It just wouldn't. I've seen patients that have lupus that they want to do some, herbal stuff. Okay, exactly. Herbal stuff for lupus, it could be like stuff that can decrease your inflammation. Yes, that can help. But if you have lupus nephritis, which means your kidneys are dying, I don't think the homeopathic things is going to help your dying kidney. You know what I mean? So I think that some patients and our people just go too far with wanting to do homeopathic herbal things for the type of disease processes that you're just losing time, essentially. You're just losing time. When I understand that you don't really want to do allopathic medicine, like, normal medicine and medications. Not medications or pills are for everything. I completely understand that. Like high cholesterol, you don't have to take medicine to reduce your cholesterol, but the problem is most people are not willing to do the things that's going to help you decrease your cholesterol, so which is why medication is given. You know what I mean? The reality is that when someone is diagnosed with high cholesterol, we talk about lifestyle changes, modifications, things to do to try to decrease the cholesterol. We give you like 3 to 6 months. Most people are not willing to do the work, which is why we end up giving medication. But if you can do all those things that will help, in terms of herbal stuff, absolutely go for it. So my perspective is we just try to make it like a panacea for everything, and it's not. You can't do it for cancer. You can't do it for lupus. You can't do it for the things that are life-threatening and think that that's okay. So I'm all for it. My colleagues are for it when it's realistic. I guess that's the point. But the problem is we try to generalize it to things that are not generalizable.
Yeah, I mean, once again, that goes back to the distrust of the medical world, thanks to like Margaret Sanger and Planned Parenthood and how that was created. No matter what Planned Parenthood does now, the origin of it is so wicked and sinister that people just don't trust folks. We look at the Henrietta Lacks situation with the cells and how the family is still not compensated, and Henrietta Lacks lives within the medical community forever now. You know? And I see with us doing the naturogenic things, I have a doctor. Shout out to my doctor. He's a nut. You know what I'm saying? I love him to death. He's a vegetarian. And he was telling me, yeah, you got to do this, you got to do this, you got to do this. And I was like, he told me he's a vegetarian one day. I was like, well, then why didn't you never teach me about being a vegetarian and how that helps me? And he was like, well, you never asked. So I was like, well, if I never heard you talk, how would I know what to ask you? And that's always been my issue with the medical profession is people have a lot of the answers, but you have to ask to get instead of it being freely given. Why do you think, in your opinion, so many doctors do that instead of giving the full truth of what you can do to be healthy, not just get well?
I think there's maybe 3 prongs to that. Number one is the way healthcare is delivered. The delivery system is not fostering for the kinds of conversation that will get to the point of having different conversations about what you can do. When healthcare system basically says you see a patient every 15 minutes, how much can you really have a conversation in 15 minutes, right? Healthcare has become more like, documentation because of, malpractice suits and all these things. So you're just heavy on documentation. There's not really much of a support of ancillary support. They're no longer having, they used to have a diabetic clinic so they can talk about different ways to reduce your blood glucose, right? So healthcare has shifted from what it used to be like in terms of like just being able to talk to your doctor for 15, 20 minutes, you know, just have that conversation. So that's number one, is the healthcare delivery system. Number two, the people that are going to medical school and the way the medical school had been training doctors, they pick the people that have higher scores, but not really good people person. You know what I mean? So they're more like, this is like, you have diabetes, this is medication we give to you, boom. So there's not a, you know, open dialogue in terms of like, you know, it doesn't have to be medication, you can do this, you can do that. And then number three is that when there's like this self-fulfilling prophecy when a doctor feels like this patient doesn't trust me, right? And the patient already comes with distrust. Like we've already talked about all the reasons why we come with distrust. It's not to say they don't care to do it. It's more to say, you know what, she's not going to hear me anyway. He or she's not really going to hear me anyway. But so I'll just treat the problem, right? So, and then we're not really trained to have conversations like you're saying that we should be having. And I agree, we should be. And I feel like that's really how I practice. You know, I tell patients like, you don't really need this medicine if you can just lose 10 pounds, and we can talk about how you can lose 10 pounds. So that's the way I educate and communicate with my patients. But again, it's because I recognize a need, and not to say a lot of my colleagues don't, but I think that even if they wanted to, the time factor is a big issue. You know, primary care doctors are so swamped, and that's the truth. They really are swamped. Is that an excuse? It's not an excuse, it's a reason, because they're so swamped, and the way that they are forced to have to see so many patients and all these things, it just really does not create an environment to accomplish what should be done. Like you said, it should be. I just don't have a really good reason how we can change that, except for doctors that really care. Again, it goes back to find a Black doctor that will more likely. Is your doctor Black? No.
Yes, he is. But I tell you this though, since the 1980s,
yeah,
doctors have been called pill pushers.
right.
And people say, well, if a doctor gets paid for pushing pills, he'd rather give you a pill than give you a prognosis or a diagnosis. They just say, you hit it, take a pill. All right, I get a new car. That's what's been another stigma that's been held upon doctors. Are doctors paid per pill or prescription they write? Explain
No,
that.
they're not. They're not. I feel like that history has been attached to physicians now, but maybe in the past, absolutely. So no, they don't get paid for the pills that they prescribe. What they do get paid is for meeting the standards. What I would say, what that means is like, so in order to try to standardize, which means making sure that all patients are receiving the same level of care, right? You know, the protocol that says a patient that has diabetes, in your practice, are you doing all these screenings that you're supposed to do to catch patients that might have diabetes? If you are, at the end of the year, because you're meeting all that standard, you might get a bonus, right? If you're meeting that standard, how many of your patients are you actually treating? Because again, because of the healthcare disparities, right? Two patients are in the same practice, one Black, one white. If they meet the same criteria for treatment, and the white patient is getting treated, and the Black patient is not getting treated, you can catch that by making sure that all the doctors are doing the same thing by each criteria. Like, you know, this person meets the criteria to be treated, make sure they're getting treated. So it seems like, you know, a patient comes in, diabetes, medication, making sure I'm just ticking off. So now we're becoming more ticking off people. You know, we don't make sure we're ticking off, like, we are treating diabetic patient by medication, when you can also treat this patient by having conversations about weight loss and exercise and things like that. So in the past, yes, they may have been getting extra money kickbacks from, pharmaceuticals and stuff like that, because they were prescribing a certain medication. But now they don't even allow, a lot of places don't even allow pharmaceuticals to come to their offices anymore. Again, we're trying to remove that biases, right? So that you're not just prescribing a medication just because, pharmaceutical rep came and give you some lunch. So that they're cutting those things out. But what it looks like now is he's just pushing medication on me. But really, what they're trying to do is make sure they're checking off their standards that, Medicare and all these people have created, that says that we can make sure we can try to catch people are being like, so that someone from, you know, rural Mississippi is getting the same treatment as someone from like New York City. Again, all, how do you say that thing? All roads to hell are paved with good intentions. I don't know.
Yeah, that's
So
how
it's
it goes.
looking differently now, but it's for a different, I guess. So no, we don't get paid for a medication that we prescribe. We just don't.
That sounds like the education system. Because with us, they're taking away our time to really nurture and care for the kids and sit with them to just check off boxes to see if we have evidence that they are being taught or interacted with instead of being taught and for the teachable moment. So we're turning people into robots. This is all
Pretty
robotic.
much. Yeah. Fatherhood.
So, nah. So the thing about this whole conversation is, even with the stigma of pushing pills, people are afraid of being pushed upon the vaccine.
Yeah.
Now, this vaccine comes with a lot of question marks. It comes with a lot of uncertainties.
Mm-hmm.
But one, there's two vaccines. There's a Pfizer vaccine and a Moderna vaccine, correct?
Yes.
Can you tell us the differences of both? Do you know?
Number one, Pfizer has about a 96% efficacy rate. Moderna has like 95. Number two, they're both mRNA vaccinations, and that's just too extensive to explain that. But basically, the Pfizer vaccine requires a different ways of storing it, which is because based on how their research came up, how they came up with the vaccine itself, their requirement is to be stored in a really like sub-zero like temperature. Moderna vaccine doesn't require that. So I would say Moderna vaccine is appropriate for reaching patients or in like, you know, inner city, rural areas where you don't require sub-zero storing of this vaccination. But they're both mRNA, and mRNA basically means messenger RNA, which means that they have created a protein that looks like the coronavirus, so that your body, it looks like it, don't look like that. It's not actual virus. It's a copy of the virus. It's basically saying, how can I explain this? It's like a fake picture of, you know, something for your body to recognize. Like, you have a vaccine itself. The vaccine, if it was in your body, will make an mRNA, right? That's how it kind of goes around all your body. Like, it replicates into a messenger RNA. It's like a copy of its DNA. So what the vaccine does is it presents as if this is a copy of the virus, but it's not really, so that your body can recognize this as foreign and starts to create like antibodies to fight it. That's basically it. Within like 8 hours, this vaccine that you got is dead, right? But it has created it set in motion your body's recognition of this vaccine, of this supposed virus, so it can create a copy of it, so that when you do get exposed to it later on, it's no longer new to your body, which means your body is able to fight it off and not get you as sick as you would have been if you didn't get the vaccine. So that's the difference. It's just how it's stored, you know, the efficacy rate, which is kind of the same in terms of how well it works. But you require 2 doses for each one. So.
Oh, both are 2 doses?
Mm-hmm.
Okay. Because a lot of people were saying that this vaccine is like DNA writing. It like changes your DNA and things
It
like
does
that.
not. It does not.
Ripping RNA strands and then making new things for people.
No, it does not.
I'm telling you, like, I look
No,
at
I
everything. So we need to address people's thoughts on this interview, because I myself am not, I don't trust it to take it, you know, and because I don't like the social ramifications that come with it. For one, I don't trust Bill Gates at all. And the conversation about population control has not only come out of his mouth in TED Talks, it's been in the subjects of television shows, movies, and all this. So it's a little too coincidental for me. You see what I'm saying? And plus, I just don't trust needles. I don't take flu shots. I don't take any of that stuff, because me, myself, they hurt like hell. I have a very strong reaction to needles. So I don't want it. It hurt like hell. And then faith-wise, I just don't trust people. The medical profession really ticks me off. I have a lot of respect for people who really do it and care for the people and what they do. But I know there's a lot of people who are doing things and they have no understanding of how evil what they're doing is, because they're hurting people. To just go into my point, it was a case a couple years ago where what was it, the flu vaccine, and one was going to a suburban area, one was going to an urban area, and unfortunately the packages got switched. So then they wrote an immediate cease and desist on giving the same, was supposed to be the same vaccine in the inner city, the one that was supposed to go to the suburbs. The inner city was told to not give it and return it to where it was supposed to go because it was not meant for them. If there's a distinction of things like that, I don't trust these people. I don't trust these people at all. I want to ask you this though. That level of distrust for the vaccine is taking it to a point where people are trying to make this vaccine a social movement. When you took the vaccine, correct?
I did.
And you took it voluntarily.
Yes.
Why did you take it voluntarily, and what statement did you want to make to people who are going to ask you, like today, and for people who were going to be intrigued by it?
So yes, I took it voluntarily. It was not a requirement from my job, and which is different from a flu vaccine, which is essentially required for us if you want to work in the healthcare system, unless you can show that you have an allergic reaction to it. And the reason that I felt like I was going to do it, take it voluntarily, was because I recognized the, I don't think it was apparent before until the vaccine became a real possibility. It was because going to work, I didn't realize how much effort I had to put into compartmentalizing going to work. You know, because when I'm going to work and I know that I'm going to be facing COVID every single day, you just stop thinking about it and just focus on the work that you're doing. And so for 9 months, 10 months, I was just focused on going to work, always like having my protective gear on and just not really recognizing how much I had to kind of not like pretend it wasn't there, but have to do the work even though I know I was going in the face of every day possibly getting this virus, right? And so knowing that there was something that was finally going to be able to ease my mind in terms of like, if I do get it, again, and knowing I've seen, you know, the worst of COVID. I've seen a 24-year-old that needs a lung transplant now because of COVID. Like, that's what I've seen. I've seen emergency C-sections done in the ICU because either the mom is going to die or we need to deliver this baby quickly. Like, I've seen those things. I've also seen how easily it is to get it because a lot of patients we're not taking it seriously. So when I go in a patient's room, before we can test them for COVID, I have to make sure that I still have to go see this patient and not knowing whether or not this patient has COVID. So my point is seeing like maybe a possible end of the road for, you know, even if I do get this, virus, at the very least, I would not be, you know, susceptible to the possibility of getting the worst of it, right? Because I do have a, you know, what is it called, a high risk factor. I have hypertension. And so knowing that, I just thought like this is something I can do for myself so that way I would, you know, there's a good chance that I will be okay if I did get it. And, you know, that's how a lot of my colleagues felt because we just see this terrible way of how COVID can just affect so many people that I felt like I needed to do something that's going to protect myself, but also protect my family because, you know, coming home and not being able to touch my child for many, many months when I come home is just not a way to live. And so I just felt like I needed to do it if I wanted to keep, you know, wanting to go to work and not feel like I have to keep suppressing this fear of getting this virus. So, yeah.
I think this virus is scary on many levels. For
It
one
is.
thing, I didn't know this virus had an ethnicity or nationality because I'm finding out we have UK COVID, which is new in America now. There's Italian COVID and there's South American COVID. We have COVID with SARS, COVID with HIV, COVID with herpes symptoms, something. And this was all reported through these Young Turks, MSNBC. They talked about the different things that came with it, and even talked
the
about
variants, the
variant strains and things. And they even talked about how, with all the cleaning and antibodies and things, we're going to open ourselves up to things that were in the past coming back because we're taking so much of a precaution that we're lowering our immune system. So let's talk about the immune system and go back into the shot because a lot of people think the shot is going to hurt the immune system. A lot of people think it'll help their immune system. My question before the shot is this. A lot of people are wearing masks because they believe the mask will boost their immune system. What is the advantage of wearing the mask and how that helps during the corona season?
I don't believe the mask would boost your immune system, but the advantage of wearing the mask is to decrease, number one, the severity of the disease process if you were to get it. So, for example, if I was in a room, a small room like my bedroom right now, and it's like 5 people, one person had COVID, coughed everything in the air. I didn't have a mask on, but 3 other people had the mask on. You can believe that I will have the most severe symptoms because I'm getting the higher viral load from that ingestion of that cough. Versus someone that had the mask on, let's say if it were to put a number on it, 5 million copies was in the air. Maybe 2 million went in my nose. But the person that had the mask on maybe would get maybe 100,000 copies, if they would get it. So can you imagine someone that had a mask on? Yes, you may still have gotten the COVID virus. Maybe you get sniffles or whatever because they had the mask and it protected them from getting 90% of that virus. Versus me, who had no mask on, I'm getting a significant portion of that viral load. So I will get a lot worse sick. So that's the benefit of the mask. Or if I have COVID, I have a mask on and there's 5 people in the same room and I cough, maybe 10% of that will come out through my mask. Again, 10% of a viral load for every other people that's wearing a mask, they will maybe get like 10 copies of the viral load. It would not even show that they had infection. So yes, the mask really helps. So people say, oh, well, you still got the virus anyway, even though I was wearing a mask. Well, when you wear condoms to have sex, sometimes the condoms break. It's like, right? So condoms is supposed to not 100% effective, right? It would decrease your likelihood of getting HIV. It would decrease your likelihood of getting someone else pregnant. But it's just because the 1% may or may not work does not negate the fact that 99% of the time condoms work. So the argument of, oh, I wore my mask anyway and I still got COVID, it significantly decreases your risk of getting COVID, period. I will give you an example actually. And I think we're going to get there. But what I was telling you that I had a new update. I feel like I recently got COVID and I got the mask and I got the shot and I wear my mask. I wear like the N95, all of that stuff. My symptoms only is I had fevers and I've had chills. That was it. I am 100% sure it was because I had the vaccine that I didn't get worse symptoms. And this was, what's today? Friday. I had symptoms Wednesday and I'm still talking to you right now. So I'm pretty sure like if I didn't have the vaccine, because my medical assistant, who I'm pretty sure I got it from because we work so close together, she had fever, aches, all these things. Like she was getting ready to go to the emergency room. That's how bad her symptoms were. Mine was just like fevers and chills. I didn't even feel body aches. I didn't have loss of smell or taste or any of those things. So I only got 1 shot of the vaccine and that's only 50% effective until I get the second shot. So it does help. So anyway, go ahead.
Shout out to Dummy because I asked you a question, Dummy. And that was about the mask and the immune system. Because I'm like, how's the mask boost your immune system? But I wanted to ask, and the reason why they asked this is because it is. A lot of people I've seeing myself, they're putting like Vicks in like eucalyptus oil in the mask so it helps their ventilation. But they're asking another question they asked is, how often should they change their mask and should they wear the same mask every day?
No. Well, I guess it depends on how much exposure, opportunities for exposure do you have. So for me in the hospital, I have a high opportunity for exposure. So I wouldn't wear my mask every day. I change my mask every day when I'm at work. But if you are only wearing your mask just to go to the store and come back home, or go to whatever and come back home, I think you can use a mask for maybe up to like 3 or 4 times, but you have to keep switching it. And I'm talking about the N95s, like the regular mask one. Every time you go out and you use it, you got to get another one. You can't be using the same one like for 10 times because if let's say you did acquire, COVID virus on that mask, you keep taking it off and putting it back on. It's on your hands. It's on everything that you're touching now. So no.
Again, shout out to Dummy because that's your question. No, this person's literal name is Dummy. So
oh my gosh,
don't think I'm making fun of somebody. Nah,
okay.
Shout out to Dummy. That's my peoples.
Shout out.
Don't call them Dummy because they always say really, really weird stuff.
Okay.
But so we should change our masks, the corner store mask, the dollar mask. We should change those masks daily. because if we're around somebody with COVID, we could infect ourselves.
Correct.
Okay. So then that goes to the question about the vaccination itself.
Mm-hmm.
I recently had COVID, or not recently, but I've had it. There's people who have been exposed to it. Should they get the vaccination if they've already body's supposed to already be building antibodies and stuff to fight it now?
Yes, I think that they should get the vaccination. The reason why is because we still don't know a lot about how long this immunity lasts for, because there have been patients, I'm sure you guys have heard about the antibody treatment. I forget the name of it, but that's one of, like, people that had COVID in the past, they drew their blood and found antibodies. But there's people where after 6 months later, they no longer have the antibodies, right? And so it remains to be known how long this immunity lasts for. But what we do know is, based on how severe you got sick, the immunity lasts a longer time, because presumably your body had to work really, really hard to fight off this infection, right? So like, if your only symptoms from the COVID infection was, body aches and like a little fever, and it was over in a few days, you're likely not to have that long-term immunity to COVID. So yes, definitely you should get the vaccine. But let's say, God forbid, you had to be in the ICU, you were so sick, and all these like severe symptoms that you had, or a prolonged nature of the course of the disease, it doesn't mean that you shouldn't get it, but we presume that, you probably have a longer immunity to that. So if you're like if you're like you're, distrustful of, vaccine, but you got freaking sick really, really bad, then maybe you can lean on, I got, I may have immunity to it. It doesn't mean you can't get infected again, but presumably your body will be able to recognize it sooner and kill it, and then fight off the infection sooner. So yes, you should still get the vaccine if you had it.
I had a friend who caught it 2 months apart from itself.
Mm.
He works in the prison system.
Mm-hmm.
And like, this is one thing about COVID that's very scary for me. I have 7 friends who've had COVID, and all of us had different symptoms, and
Yeah.
all of us got different prescriptions afterwards. I was prescribed vitamin C, vitamin D, zinc, aspirin, and I forgot the 5th one. One of my friends, all they were giving was aspirin. That's it. Another person was giving something for diarrhea, and he lost his vision for 2 days. You see what I'm saying?
Yeah.
So like, we all distrust this vaccine because we don't believe that the American government is doing what it can for the safety of people of color, whether you're ADOS, foreign or domestic. We don't trust them. And the worst part about this distrust is the social ramifications of this vaccine are now, can you go back to work with this thing? Can life ever go back to quote unquote normal if you don't have your papers? And now, I don't know if you've seen in the news, they're going to have the COVID, they already have the COVID app that you could download on your phone that tells you, it uses the your location to tell you people around you have had COVID in that area. Not meaning the people that you're with have it, but it was there. But now they're updating the app to make it more sophisticated, where it could read other people's phones, which could be grand larceny if you take the information, and invasion of property. But it's going to read other people's phones when they scan, and you're going to have a code that says you took the vaccine. These are the things that makes this vaccine so absurd, because it's not only medical, now it's turning into social identification. How do you feel about that? And do you think that it should be mandatory for everybody to take it to go back into society?
I will answer the last question first. I don't think it should be mandatory because, the distrust that, people have, and, it's not just, our Black and brown folks that have distrust. Even some people in medicine, like some healthcare workers, they don't want to take the vaccine. So there's no way that you're going to enforce people getting this vaccine. It's just not going to happen. So I don't think it should be enforced on people, but I do highly recommend it. It's going to require about 70 to 80% of people, of the population, of being vaccinated in order for us to kind of go back to life as a semblance of what it used to be, because that's the level that we need to reach for what we call herd immunity. And I don't know how realistic that would be, because, there's too many people that have distrust, like you said, for this vaccine. In terms of, what was the other question? I'm sorry.
The social ramifications
The
of it.
social the social ramifications of it. Uh, I really wish that it wasn't such a divide between healthcare and people just trusting medicine. And I hear you when you talk about, government and, the distrust that government has to maybe whether or not they're having some ulterior motive with this vaccination and, registering for all these things. I totally understand that. The delivery of vaccine is on a state level. So even if the federal government has this whole, ulterior motive about what we're trying to do or whatever the case is, whatever possible theories that people have, it's still on a state level that this is delivered. And so it still has to come to, the doctors that's prescribing it. I don't think that all doctors are going to ascribe for something that is going to be intentionally trying to hurt my community. With regards to, collecting data information that you mentioned, yes, when I took my first dose, they wanted information about like my background. They didn't want my like actual name, whatever. It's to collect the information so that people that do have distrust about this vaccine, we can collect more information about, what did, this person have, what are the most common side effects? What are the most common whatever associated with this vaccine that this person get? This is how we get information so we can let people know that it was safe. When 2 million people have gotten the vaccine, now you have 2 million information to say, is it still really safe? Do we have any other symptoms that we didn't know about from the study itself? Or was there any severe side effects that we didn't know about? This is how we get information, right? And so the information that's being collected is not personal information, at least from the documentation that the card that I have to sign is really background, African American, which vaccine did you get it, which, is it Pfizer, is it Moderna? So those are all the social information that we're trying to collect so we are better able to have a profile of this vaccine so that come June, July, when, it's probably available for the mass people, now we have 4 or 5 months of information that we can say this is what it's looking like. So, yeah.
I wish these people who are in charge are as educated and as mindful as you to the things that are going on, because Fauci is one of the biggest idiots I've ever seen in my life.
I agree. He's such a good guy though, but God.
I don't think he's a good guy. I think he's an asshole. But and one of the things that solidified it, like, how you make a cake, you had the icing and they say put the cherry on top. The cherry on top for me with Fauci was when he said, I want to tell my Black brothers and sisters, that right there.
I know.
And then he said, you should take the vaccine because a Black woman made it. And I'm like, nigga, serious?
It's the disconnection, right? It's a disconnect between what he thinks is going to work and what's really going to work. Like, it's just, it's like a white person trying to break down so he can like be cool with the Black people, Yeah,
it's called television. We see that every time. You know what I'm saying? Yeah, we see it every day, believe me.
I know. And
in the hip hop circles, we see that with Adam 22 and damn DJ Vlad and all the other people that they call culture vulturing. Exactly.
Yeah.
I'm like I said, still, I applaud you for having this conversation with me, and I thank you. And my thing is, have I been eased on it? I will not share. But hopefully someone who sees this will have their mind made up to what they want to do, and they'll have a clear conscience of it. Because one thing I will tell you, I do not have a distrust for health. I have a distrust for the health profession. And that's the thing that gets me probably in a lot of trouble with a lot of people. But hey, you're talking to somebody who went to school and came out with nothing. So what can I tell you? I went not to disparage people who teach. I'm going to say this: education. We don't have a lot of teachers. We have a lot of instructors.
Yeah.
When you get a good teacher, you will remember them for the rest of your life.
Absolutely.
And I've had a lot of good instructors.
Yeah.
So before we leave this episode of the Mike Council, please give everybody your social media, how they can follow you, and what you have planned in the future when it comes to your profession and maybe helping people with understanding the medical profession as well.
Well, thank you so much for having me and just giving me a platform to talk about this. I really appreciate it. I hope I change some minds, but like you said, I'm not going to change everyone's minds, but I'm very much open to dialogue. You can reach me on the Reese's Pieces, TheReesas Pieces on IG, and it's Reese's Pieces on FB on Facebook. Please drop me a note, DM me, ask me all the questions that you want. If you really want me to elaborate on anything that we talked about today, I would love to do that and dispel it. I feel like I'm an advocate for my people. Like I'm a strong advocate for my people. I really do understand the disparities that we have in healthcare. I understand the distrust that we have for healthcare people. I completely do understand that. And I'm just wanting to bridge the gap. And my hope to do that in the future really starts in February. I'm going to be a new instructor for a new residency program at a new hospital that I'm going to be joining. And my goal is to educate upcoming doctors, white and Black, on how to take care of people and listen to people and really go beyond the medicine, like, prescription, talk about the whole health. I'm an OBGYN, like I said. I think women really are cornerstones of family. So if you can teach a woman to take care of herself, how to eat better, other than having to do medication, you can teach the family the same thing. And so that my goal is to teach the new generation of doctors how to take care of the whole woman. So that's where my goal is, and I hope to be fruitful in that endeavor. Thank you for having me.
Hey, it's all good. You bring a heart back to the medicine because there's no heart in it. It's just paperwork and robotic blah blah. You know what I'm saying? So before we get out of here and I close this interview out, I want to ask you. I usually do the rapid fire questions on Heritage Hip Hop, which is about your understanding of the culture and where your place in it. Because this is a Mike Council and you're doing medicine, I wanted to do something similar and let you leave not only on a high note, but for people to understand you a little bit more and appreciate what you do that much more. So
okay.
You're willing to play this little game with me?
Sure.
Okay. My first question is this. What is the most effective health activity people can do to keep themselves in high health standard?
Walk at least 30 minutes after you eat any meal.
Well, I tell everybody stop eating late because I can't even leave your house where you live. So
that's number one. If you can't do that, then just realize how much calories that you're taking and just cut half of that. That's the first step.
Okay, that's number one. Number two, what is the worst sickness affecting America, mental or physical?
Racism.
So that's mental.
Yes.
Or is it physical? Or is it both?
I think it's mental, which can manifest as a physical.
How so?
Because, when you have a racist system that is impairing, people, a certain facet of people and access in healthcare, it becomes physical because you're not able to go see a doctor, or you don't go to see a doctor because you don't think you're going to be treated. And it becomes a manifestation of itself. And, the reason why we catch heart disease at the end stage is because people just don't go to the doctor when they need to go in the beginning. Right. And it's a racial thing, racial reasons prevent my Black people from going to see doctors. Racial reasons cause, white doctors, when they see Black patients, not to believe their symptoms in the first place. And so it becomes a manifestation of that in a physical manner. So.
Interesting. My next question. We all love Donald Trump. I think he's one of the best presidents ever. Salute to Donald Trump.
Oh, gosh.
No, I don't think he was a good president. I think he's one of the best presidents we had because he showed up everybody what America truly is about. So
absolutely. He was a symptom.
Now you know how much you matter and what you do and don't do counts,
Definitely.
So it's not about him. It's just about what he showed people. And I want to ask you, from your opinion, how has Donald Trump hurt the medical profession in his tenure?
Oh, wow. He has actually showed, he has supported not to say we don't believe that before, but he has definitely supported white, Black people, and brown people say that they experience racism in medicine, because, there's a lot of racist doctors that didn't really show their hats until Donald Trump. I don't think I ever remember seeing so many Fox News TV channels in community area up until Donald Trump. I think it gave even the doctors license to be fuck this shit, So I think he definitely showed us who we are, but definitely in the healthcare field, because for so long, we were able to kind of say they were under the radar, the racist or biased, you know, healthcare doctors, not just doctors, nurses even, you know, but now they're not as afraid to show who they are. So yeah.
A question for women in particular.
Mm-hmm.
What do you would say are the top 3 things a woman should do to keep herself healthy that maybe is not being taught or maybe being ignored in our community?
Top 3 things you said? 3. Number 1 is to really take seriously mental health, because in my office, my experience has been there's a lot of problems that they come with about their vaginas, but when I sit down and really talk to them, it really is about mental health, number 1. But the mental health is intertwined with the relationship, right? I find that number 2 is being aware of the decisions we're making about who we make partners affects our mental health. So they kind of go hand in hand. And then number 3, I would say, is really seeking having a primary care doctor. I think that we don't really do that enough, because most women only see the OBGYNs as their doctor. And so many things are missed. Yes, they only see the OBGYNs because they're, you know, for annual, you know, GYN exams, or when they're pregnant. That's it. For like 70% of women, that's the first time they encounter a doctor is with the OBGYN. And so I strongly encourage them to actually have a primary care doctor to take care of all the things that they never really want to talk about until they see the GYN. And the GYN is very limited in what they can, in the scope of what they can do. I'm different in terms of I still try to, you know, act like their primary care doctor, but I tell them, listen, if I get all this blood work for you, I'm not treating your diabetes. You got to go find a whole doctor for that. But at least I do the screening test that they need a primary care doctor to order for them. So mental health is very important, and they need to take care of that. Mental relationship, there's a lot of women in bad relationships. They really have to really understand how they choose partners, because that really affects their mental health, and also then affects your physical health. So that's why they need a primary care doctor. Yeah.
Side note, do you think that not having a primary care doctor comes from the distrust or the lack of education on the different facets of medicine?
Both. I think it primarily is a lack of information about the different facets of medicine, because when I talk to them about, you know, why don't you don't have a primary care doctor? No, I have my GYN. No, we're not the same thing, you know. But also, you know, the patients that I do try to push to go see a primary care doctor, because they're very comfortable with me, they kind of push back on wanting to see a primary care doctor because they think I can just do everything that they want me to do. No, it just doesn't work that way, because I am limited in my scope of what I can do for you, you know. So I think primarily is because of lack of awareness of the differences between a GYN and primary care. But then the second part is distrust. Yeah.
That's deep and that's sad, but wow.
It is. It is.
So another question about Dummy. Shout out to Dummy, because your
Hey, shout
question
out, Dummy. You got me all questions now.
Yeah. One question from Dummy was this. A lot of people are scared to go to the doctor, so they go to the clinic. What's the difference, and what people should know about the difference between a clinical and a primary care physician?
So when you say clinic, as in like, you know, the healthcare center,
Just like
clinic?
like a one stop or something like that, instead of going to a doctor.
Yeah. The clinic is a quick way to address an issue like right now. If you go to a clinic, there's a higher chance of missing things, because when you go to a clinic, you're not going to see the same person all the time. Every time you go to a clinic, the person that's seeing you is probably seeing you for the first time. Depending on how good they are and, you know, how good the staff is, they are supposed to go through your medical history and look at all the reasons why you've been there before. It's not always going to be consistent. And so the utility of a clinic is really for people that don't have insurance and they need help like right now, because they need to address whatever issue that they have. And then the clinic is going to help, you know, navigate, send them to different places. But again, it's a delay in care. If, like, say you do have something that needs to be followed up on, but you're going to a clinic, all they can do is refer you. It's not on them to make sure that you go see the person, to see the doctor. But when you go to see a primary care doctor, hopefully you're seeing the same person all the time. This person knows you. This person knows your history. They don't have to keep looking at your, the visits that you had 2 years ago, a year ago, because they're already aware of who you are and your medical background. So they're more likely to be able to hone in and zone into whatever ailment you're having right now, but in a longevity type of way. There's a better way to do screening tests. This is how we find diabetes early. This is how we find, mammograms, pap smears. Those are the things that they do on a screening basis that, clinic, they don't really have to do, or they're not even equipped to do it, or they don't have the staff to do it. So there's a lot of things that get lost in that sense. So yes, primary care doctor.
We cannot leave the men out of this.
No.
The stigma with Black men is that Black men don't go to the doctor. I can tell you for a fact that a lot of reasons Black men don't go to the doctor, once again, is the distrust of the medical profession. And a lot of them, especially older folks, just say, I'm all right, just give me a pill, just take a pill. Me, I come from the era of, I don't take pills. No, you either gonna find out what's wrong with me, or I give it to me in liquid form, or the hell with it, I'm good. What are the 3 things you think is necessary or affects men that they should go to the doctor for that they're ignoring?
Number one, I don't want to discount mental health in men either, because there's a lot of depressed men that have a lot of history in their background. This, depression, anxiety, all these things are not limited to just women. And what I'm finding is men just have a different way of coping with it, or maybe not coping at all. And so again, mental health is, in our community, is so under addressed and undervalued in terms of the severity of how it affects everyday life. We don't even talk about it, or we talk about it in a way that, you just get over it, or it's just something that it shows it's weakness. It's not weakness. It's just not weakness. So mental health, I would say, is a primarily important factor that needs to be addressed. And having a regular doctor would be able to figure it out, because they just know you better. Well, not know you better, but based on what you're coming in with, based on your, demeanor, based on the conversation that you're having. Again, hopefully it's a Black doctor that knows your plight in different way. I think that is very, very important. There's very much underdiagnosis of diabetes and hypertension in Black men. Again, it's because we don't see regular doctors, so we don't do the screening test. So there are a lot more people in the pre-diabetic stage than they are in diabetic stage. And the reason why we are worse in diabetes in terms of Black people, but it's very much Black men too, is because we're not seeing doctors so they can start doing the screening test in the early parts of it, so we can catch pre-diabetes. And so screening test is very important. I think a lot of men think that they need to if they go to the doctor, they're going to find something wrong with me. Yes, after 10 years of not going to the doctor and you finally go, guess what? We will find something, because you haven't been doing the things that we needed to do to catch something that could become something bad early on. And so, yes, we need to see doctors so we can go get our screening test. Colon cancer is one of the things that we need to really focus on. It's so bad in our community that even the American Cancer Society says 45 is when Black people should be getting tested. Guess how many times, how often Black people go to see the doctor? Later. I'm having patients that are 55 years old and haven't gotten their first colonoscopy, or a patient of mine, but her husband is 55 and hasn't gotten a colonoscopy, when you should be getting colonoscopy at 45, So I would say mental health, primary care doctor, and sexual health. We don't talk about that enough. But again, sexual health is tied into the diseases process, like diabetes. Diabetes is a big issue with erectile dysfunction. So we're treating erectile dysfunction, but we're not treating the underlying cause, many times being diabetes. So those are all the things that a doctor can really address for you that we're not really going to see.
Shout out to racism, because it keeps diabetes alive. I really believe that, because everybody always talks about the liquor store in the community, the fast food choices.
Yeah.
We don't have a clean living area or environment in our society. So thank you, America. Thank you, racism.
Mm-hmm.
Keeping people fat and unhealthy. Thank you so much.
Seriously.
So I have 3 more questions, and then we're going to walk away with a smile on our face. All right.
All right.
So everybody, once again, this is Dr. Theresa. Make sure you follow her on
Hey, y'all.
Reese's Pieces.
The Reese's
The
Pieces.
Reese's Pieces. Make sure
Yeah.
you do that. Make sure y'all do that. So my final 3 questions, let's go to the first one, is this. Why, in your opinion, do you think more doctors don't speak to the youth instead of waiting to see the youth in their office?
Honestly, I feel like it's time. I feel like for me, I would say for example, for me, I've always wanted to talk to the youth, but the amount of time and the commitment that it would take without having the already set path. Like if there was a school that already has a pathway to say just bring doctors in and to come talk, I'm all for it. But in terms of there's not the avenue, maybe there is, and they're just not reaching out. And if they are, please reach out to me. I would love to do that. But I think it's the time, if I have to, galvanize, take myself to a school to try to, open myself up and say, can I come into your school and talk to students? You get pushback from the school principal, whatever the case is. So it's not something that I won't be able to just say, oh, I'm gonna go to the school and just talk, because one, I don't have the time to be really focused and commit to that. I hate to say that, but my hope is my new job, I will be able to do that. So yes, I think really the forefront is time, but also I don't think there's enough schools reaching out to doctors for that same thing. And so if they have more of that, I think there's a lot more doctors that will be willing to do that. Because I remember in medical school, I had a lot of times I was really involved in like the local school, like, having like a baby, big brother, big sister. Like I had that. So I had time to do that as a medical student. I definitely don't have the time to do it as a resident because I work like 40-hour weeks, you know what I mean? 80-hour weeks, I'm saying. So I wouldn't have time to do that as a resident. But as a physician, like practicing on my own, I also don't have time for different reasons. I have a son and all those things. So I think if it was easier to partake in that, I think more people would do it. I just don't know if there's a avenue for that. And if there is, please hit me up. I would love to do that.
Once again, shout out to my high school because they didn't teach me shit. Well, our preschool system, we like to have people from different professions come in, but it's only built on that study. And then you have the career day or something. And doctors, schools will bring people in to get people to college to make their brochures look good, but they're not including the community in the conversation,
Yeah.
And I find it very offensive, but it is true when they say that growing up, young men see the drug dealer and the rapper and the athlete because that's what they're exposed to every day, of people who look like them, where we don't have the entrepreneur, we don't have the radio person, we don't have the doctor, the teacher, the lawyer, the business professional, not just street business, but we don't have the business professional coming to speak to the youth. And shout out to people like my man Kaid, who really is doing great things in the school system. Shout out to Miss Aglaya Fouché, is another professional I know who does things for the parents to know about first-time home owning and things in the school system, so that there's hope to look for something further rather than to look for something apparent. You know what I'm saying?
Yeah.
Second to last question. I hope you enjoyed this interview. I tried to ask some good questions.
I am.
And shout out to Dummy, because you gave me some great questions, Dummy.
Thanks, Dummy.
My second to last question is this. Define health and how a doctor not makes you healthy, but helps advance or heighten your health.
To me, health is the state of, what's the word I'm looking for? Alignment of your mental health, your emotional health, but also with your physical health. All three has to be aligned. Your mental health, like I said, I feel like I'm a broken record, but mental health is so important, which is why I think that a lot of us do not really focus on mental health, because there's a lot of, to me, when there's anxiety, there's a lot of anxiety, when there's all these like things that makes you feel like you're on edge all the time, it's because there's a misalignment of your mental energy. It's a misalignment of your emotional energy. And those two things, believe it or not, affects your physical health as well. And so to me, health is, they have to all come into alignment, which is why you can't fix like, you know, your diabetes, but still be anxious all the time because you haven't really focused on your mental health. It's just, diabetes is fixed, but then you're also making decisions based on like anxiety and, you know, irritation or whatever, the depression or whatever the case is. You're going to be making decisions that's not going to be fostering emotional health. And so I feel like, how can doctors help with that? It seems like a lot because, like I just said, like the healthcare system is not really fostering of a conversation that is required to try to make sure each patient is addressing the mental health and physical health and emotional health. It's just not created in a way that is supposed to be conducive to that. My hope is that we change to that. But in the meantime, at least from my perspective, it's really asking about my patient. So how are you doing today? Like for me, when I see a patient and coming for a regular annual exam, it's not just about her vagina. It's more like, how are you doing today? How's your family? How's your husband? How's your boyfriend? You know, how's your sex life? Because that's a small window so I can really, really get into relationship problems when I ask about sex life and they tell me they don't have any or it's great. You know, those are two different facets that tells me how the relationship is going. And when the relationship is not really healthy, so does everything else falls by the wayside. You know, if you have a problem with your child, you know, anxiety, whatever the case is, the mom is not really addressing her health. You know what I mean? And so I really make a point to really ask about the entire person. And I think that one of the things that healthcare providers can do really is not to look at a person just based on like, she's a diabetic patient, she's a hypertensive patient. Like you have to look at the person as a whole, because you might actually be able to fix the hypertension if you fix her depression. You might actually be able to help her fix her diabetes because she's depressed and she's eating all this food that she's not supposed to be eating, you know? So I think that's the way that we can address the whole person to make health in alignment.
Before we go to our last question, for everybody out there watching, thank you for watching the Mike Council, our talk show, which features great people who may not rap, but are part of our hip hop culture that brings our culture to the next level of education, enlightenment, and today we have health. To see more, you can visit us at www.heritagehiphop.com. You could subscribe to our YouTube channel. You can also catch our interviews on Spotify, Apple, iTunes, everywhere. Heritage Hip Hop is everywhere, and we're not only about beats and rhymes, we're about you, the hip hop culture. So we are more than music. We are God's heritage, and why not you? If you have a story to tell, if you are a professional, not only a rapper who has something going on and you would like to have this open, honest conversation, you are more than welcome to come to the platform. Once again, thank you for watching Heritage Hip Hop. We ask that you subscribe. And if you would like to donate, our Cash App is $Heritage Hip Hop. We only ask for $1, but if you want to give more, thank you, and God bless you. Just the same way. So my final question of this interview, of our wonderful show, make sure you subscribe, is, with the vaccine now as the major talk in the world when it comes to COVID-19, what, in your opinion, is the future of medicine, and how do we get past this stage to go to a better state?
Big question. Good one. The future of medicine, even though I'm hopeful, I'm a little bit trepidatious. Like, I have concerns that it won't get past this divide that we have, which is the distrust of medicine. I do believe the future of medicine is morphing into more of a concierge medicine in a way, not in terms of like, you know, the people that can afford like a private doctor would have a private doctor. You know what I mean? Like like a doctor that's going to just have like 10 doctors that pays into, like, you know, you give me 5,000 and I'm your doctor for the whole entire year. You know, because of the limitations that healthcare system has placed on physicians. And I think that's unfortunately one of the places that it might go to. But for the rest of us who can't really do or know or are not interested in concierge medicine, I think we have a lot more of the growing population of new doctors that really do care about, you know, mental health and like those kind of things. So I'm hopeful that the future of medicine will really, really address mental health as an important issue that it is, and using that as a part of the entire healthcare, like treating the entire patient. I really do believe that, because the structure, the curriculum of medicine is changing to that effect. The structure and curriculum of medicine is addressing a lot of the implicit biases that we know is in healthcare. You're smirking, I know, but we're working on it. I'm telling you, we are. And for example, like my new coming job, one of the reasons why we got approved for the residency program is because it's heavy on addressing implicit biases as part of the curriculum and in part of really how we teach residents. Because, you know, caring about the whole person, it doesn't really come second nature to some people. You have to teach it. And so, you know, just because it doesn't come nature to you doesn't mean we can't teach it. The problem is, in the past, you've had older folks, older doctors teaching residents and teaching upcoming new doctors that were not really thinking about it. So it was never really taught. It was never really ingrained or presented as an important thing to learn. So now that a lot of curriculum is changing, I think that that will go with that too. I really do believe that, because there is a commitment to it. And I think the COVID vaccine, the COVID virus really has shown a big light on the deficiencies. And I think a lot more people in healthcare care about that than not. I mean, are there still people in healthcare that really don't give a fuck about racism and stuff? Yeah, but I think a bigger proportion is now aware. I will call them allies. And it's hard to say. I mean, I know it's hard to kind of believe, but there are a lot more of my colleagues who are really white colleagues who are really strong in wanting to be part of the solution to the problem. So I'm really hopeful for that. I just hope that the system of healthcare can survive the time it's going to take for that to happen. It's not going to happen overnight, but you know, we have to do something.
So let's do something together. Everybody out there that's watched this, thank you for watching. Please, young men and young women out there, consider the medical profession, and don't let somebody tell you, well, I'm not good at this. So you say, okay, then I'm not good at that. Me not becoming a doctor came about because I found myself not being able to take on the math in the career. But that doesn't mean that's not right for you. If you're good at math and you want to help people, consider being a doctor. We need more doctors, lawyers, and people in society than we need rappers, than we need athletes, and we need people who are getting shot in the streets, not meeting their full potential. So with that being said, Dr. Theresa, I thank you once again for coming on the show.
Thank you for inviting me.
You have an open door anytime you want to talk.
I would love it.
This is Cashapp from Heritage Hip Hop saying peace, and we out.
We out.
Thank you for watching this episode of the Mic Council on Heritage Hip Hop. We ask that you go to our YouTube page and you like, comment, subscribe, and share this episode. You can also follow us on Spotify, Apple, or wherever you stream your podcast. And please subscribe and become a member of www.heritagehiphop.com.